Hello and welcome to Health Matters on Channels Television. Thanks for joining us. I am Mary Alale Yusuf. It is usually an occasion of joy when a new baby is born into a family. Yet up to 1 in 10 mothers may experience a clinical depression within a year of having the child, called postpartum or postnatal depression. That's according to information from the Centers for Disease Control and Prevention. What may be shocking is that a certain, though smaller percentage of new fathers also go through phases of postnatal depression. My guest on the show today is Dr. Moturayo Oyelohunu. She is a consultant psychiatrist at the Lagos University Teaching Hospital, Idiaraba. Well, she was there before she moved on to Good Tidings Hospital at Surulere. She's also a fellow of the West African College of Physicians. You're welcome to the show.
Thank you very much for having me today.
A new baby is born. Yes. Everybody's supposed to be pleased and happy. We understand that a lot of emotions are being thrown around. You know, there's a lot of work to do. But depression, why?
Well, there are so many factors that contribute to a woman having depression following pregnancy. Some women are already at risk, even prior to being pregnant. Some have a prior history of having suffered from depression themselves. And others also have a family history. So these are some of the factors that already predispose a woman to having depression. Some also have other factors. So we talk about risk factors amongst women who just gave birth. Life events, which are things that are beyond people's control generally, can also... Traumatic experiences. But let's not forget also that having a baby is a major life event. The woman has gone through several changes. Her body has changed. A lot of hormones that were in place that supported the pregnancy, their values also drop. The values change shortly after giving birth. So that is one of the major things.
Values drop?
I mean their concentration in the blood. I really want to make it as simple as possible.
The hormones.
The hormones. So estrogen and progesterone. So their concentrations drop in the bloodstream, and these have this has also been identified as a cause of depression. Other factors include also having anxiety, even pregnancy, also having suffered from other mental health problems prior to being pregnant can actually predispose a woman to having depression.
Does it mean that if a woman didn't have a previous history of some sort of depression, she's not going to go through postnatal depression?
No, that's not. She can still have depression. Like I said, pregnancy and delivery are also major life events. A lot of people, especially after the first pregnancy, are not used to it. They've never been pregnant before. They haven't taken care of a child before. So all those things can predispose a woman to having depression. Some don't even have the necessary support. They are alone. Taking care of a baby is an enormous task. And that's another factor that puts a woman at risk for having depression following delivery. There are other factors too. There isn't really a consensus on some of those factors as to race, ethnicity, parity. That's how many children has this woman had before now.
Oh, a woman with other children can have it?
Yes.
It's not a first child thing?
No, it's not. It's not limited. In fact, those who have had it before are at higher risk of having it again post-delivery.
Okay.
Yes.
This chemical imbalance thing you talk about,
yes,
it happens to every woman, doesn't it?
Yes, it does.
Values drop. That's pregnancy hormone values drop.
Yes.
So why doesn't every woman just, have depression? Then again, most women do feel overwhelmed.
Yes.
Is this the same as depression?
Okay, let me start with the second question. There are actually 3 major disorders that can happen or that can occur following delivery. We have the one we call baby blues or maternity blues. That's the most common. Almost close to 75% or 80% of women experience this post-delivery, but it's really something very mild. You have mood lability. The mood is shifting from one extreme form to the other. Maybe at one moment she's happy.
When you see the diapers you have to change,
yes,
different feedings up to 6 times.
What you have to wash.
You're tired.
Yes. You're not sleeping much, and they're irritable, they're not sleeping very well.
So that's almost every mother.
Yes, about up to 75% of women can experience that. And it starts within just a few days post-delivery. But the good thing about it is that it usually would spontaneously resolve on its own. But that in itself could also put some women at risk of developing postpartum depression much later. Some studies have actually shown that about 20% of women who had maternal blues can progress to having postnatal depression. And I need to also add now that postnatal depression can occur within the first year of delivery. It's not something that is limited to, okay, I just had a baby, and so it's just a month, it's 3 months.
So if she has maybe a 6-month-old baby, she can just suddenly start having
She can develop postnatal depression, yes.
And, okay, let's proceed to what are the symptoms of this postnatal depression?
Yes.
What are we looking at here?
The things we're looking at are not completely different from the symptoms of depression in a woman who is not pregnant, or in anybody who is not pregnant. You have classically what we call depressed mood. By this I mean undue sadness. The woman is just not happy. She's lost energy. She feels tired all the time. Things that used to give her pleasure before, she may not be able to find pleasure in such activities. Other things include poor sleep. Sometimes some people sleep too much when they are depressed, and so it could either be reduced sleep or too much of sleeping. And then weight loss, which is occasioned by poor appetite. Some others too could have increased appetite, which can lead to weight gain. And so if these are not tied to dieting, somebody who is intentionally going on dieting, this is another symptom that one should look out for. And of course, people also experience weepy spells. They just cry, they are tearful. Some people are irritable. And then there's a generalized slowing down. People are just slower, the way they talk, their speech is much slower, the activity level is really reduced.
You spoke of risk factors.
Yes.
If one could just take away the risk factors as much as possible,
Yeah.
Of course, you might not be able to handle traumatic experiences, but making the birth easier,
Yes.
helping the woman out,
Yes.
not making her feel alone and all that. Can she prevent this thing from happening to her?
Yes, it can, by saying preventable. When we talk about risk factors, yes, there are things that predispose, that increase the likelihood of someone
But
having...
not the real cause.
But not the real cause. So somebody who has had a history before, and so such a person, it would be nice for her to have told her doctor beforehand that I'm planning to get pregnant, and of course this is when delivery would take place. We've had several experiences of women whom we've managed before in the past, and when they're about to deliver, we get to be informed, and so things are put in place. There are symptoms and signs that we tell the obstetricians to also watch out for, and so that we can step in on time. We also advocate, of course, for good social support.
Okay.
It's a time when, and thank God we have an extensive social support network in Africa still.
Nigeria, Africa is good with
yes,
that.
so having family around, also talking to fathers would also help. Fathers also have to,
okay, we'll go to fathers. We'll go to fathers later. That is
Yes.
really funny. But for the women now,
Yes.
how soon after birth can these symptoms begin?
For
Postnatal
postpartum depression, usually from 2 weeks.
2 weeks after.
Even
having
2 weeks, 4 weeks, yes, some of them start having symptoms. And the puerperum, like the postnatal period, is usually up to 6 weeks post-delivery. So this event would have started around that time.
Okay.
But like I said before, postnatal depression can occur within the first 1 year, up to 12 months after delivery.
Let's take a short break here. We'll take a really short break and be back in no time. Stay with us.